Introduction. The health-illness continuum is a graphic illustration of well-being, first proposed by John Travis and Regina Ryan. It goes beyond the physical aspect of health and concentrates on well-being or wellness as more than just an absence of illness. This paper aims to discuss the relevance of the health-illness continuum to patient care and present a perspective on the author's current state of health. Health-illness continuum's importance to patient care. The health-illness continuum is an essential framework that benefits patients' health and improves the human experience in patient care. According to this approach, health and illness can be described using a continuum with high-level health and wellness at one end and high levels of sickness and poor health, including death, at the other end. Patient status is evaluated according to this scale, and a healthcare plan is decided upon this evaluation. The introduction of the wellness component is of significant importance as the concept of health is not necessarily always a goal. As researchers put it, the concept of health is subjective and reflects an individual's perspective of quality of life. Thus, moving on a scale from being sick to not showing any symptoms is just an intermittent goal. What healthcare providers should be thriving for is the high-level wellness that involves a contented mental state and flourishing. This perspective is especially critical in healthcare and nursing. It allows us to address many issues that are not directly connected to the treatment of illness itself. Moreover, it provides an opportunity for practical evaluation of patients with chronic diseases. This holistic approach admits and welcomes different goals of healthcare. It goes beyond treating symptoms and allows to concentrate on patients' mental and emotional state, providing support and means of leading a better life. Relation of the continuum to value, dignity, and promotion of human flourishing. Value, dignity, and, in general, human flourishing have been deemed by the researchers as factors that contribute to the state of prosperity in individuals and society thriving in general. Human flourishing consists of many elements, certainly including mental and physical health, but also encompassing happiness and life satisfaction, meaning and purpose, character and virtue, and close social relationships. Dignity is described as a quality closely connected to esteem and status such that patients can live in accordance with their standards and values. Therefore, for healthcare to be able to contribute to these spheres, it should concentrate on treating patients and not illnesses. Since the health-illness continuum approach is concentrated on the mental and physical state of patients, it can be used as an effective way to promote the value, dignity, and flourishing of patients. The concept of wellness that lies in the basis of the health-illness continuum considers all facets of an individual including physical, psychological, cultural, spiritual, and intellectual. Therefore, by accepting this method, healthcare providers make a significant contribution to the well-being of individuals and society. Looking at a patient as a person with mental needs and respecting their values allows doctors not only to maintain or restore their health but also to respect their dignity and prioritize their flourishing. It is especially significant in treating people with chronic diseases or in need of palliative care. For other patients, this approach shown by doctors and nurses might bring change to their everyday lives and teach valuable lessons on how to improve their well-being beyond healthcare situations. Reflection on personal state of health and the health-illness continuum. My health state, if evaluated from the traditional point of view, is relatively satisfactory in general. I am young, moderately in shape, and do not suffer from having any chronic or acute diseases. I get seasonal colds twice a year and come from a family without cardiovascular or cancer history. However, over the last few years, I have been experiencing fatigue, tiredness, bad mood, and low energy. Quite often, I find myself in states of anxiety and boredom that prevent me from being productive. Therefore, I would put myself in a state of false wellness that manifests itself in the absence of illness symptoms. The reasons for the sensations that I am experiencing might originate in my lifestyle choices and habits. I often skip breakfast, indulge on fast food or cafeteria sandwiches, drink more than 3 cups of coffee a day, and at least 5 energy drinks a week to stay awake during classes. After coming home, I take long naps, which results in my inability to go to bed at a reasonable time, as otherwise, I do not have time to do my homework and socialize. Since most of the time I feel tired and sleepy, I find it difficult to concentrate on things I am doing. Moreover, I find it hard to find time for regular workouts. The realization that my lifestyle is not as productive as I would want makes me stressed and anxious. It feels that I miss out on many opportunities and could have done better if I were more disciplined and responsible. However, learning about the health-illness continuum made me think of measures that could be implemented to improve my well-being. Therefore, I came up with several solutions that would potentially help me. Resources supporting wellness. To improve my state of health and get to the stage of excellent or optimal health, I need to concentrate on exercising regularly, eating healthier, and changing some of my other behaviors. Among them are irregular sleep cycles, lack of time management, and creating stressful situations for myself. Dealing with these issues would allow me to progress on the scale of wellness and develop conditions for illness prevention. Starting from a neutral point of the health-illness continuum, I am determined to become more aware of my state, educate, and grow. Being already aware of the necessity to advance on the scale, I would want to learn more about healthy nutrition and find a better routine. Moreover, to normalize my sleep, I need to reconsider my other habits, such as procrastination. Thus, my plan should involve several steps: sleep at least 8 hours per night, limit the caffeine intake, plan my days focusing on allocating time to studies, workouts, and rest. However, this list is not complete, and I consider some other methods that would be potentially helpful. In addition to the measures mentioned above, I am planning on getting professional and peer support. I have already booked a consultation with a study counselor who will hopefully give me some useful tips on self-actualization. My determination is to reach the state of optimal well-being and live my life fully. Conclusion. The health-illness continuum that focuses on the concept of well-being rather than treating symptoms opens opportunities for more effective healthcare. Going beyond addressing particular health issues and symptoms allows healthcare practitioners to evaluate the state of their patients despite their illness status. Moreover, it provides useful insights for everyone interested in improving their life and concentrating on being not only disease-free but also a flourishing individual. This and many other essays are available at studycorgi.com.